Hello and good evening, this is Kuldeep Chaudhary from Health in India. We are at Artemis Health Institute in the city of Gurgaon. We are here to interview one of the most renowned neurosurgeons, Dr. Arun Saroha, who has operated upon a patient who had landed from Zimbabwe. This is a 17-year-old patient who had contacted Health in India sometime in late September, early October about the colloid cyst surgery. The patient was in touch with multiple hospitals in India and had sought the advice of Health in India about who would be the best surgeon who's capable of treating this kind of condition, because the patient had been undergoing treatment for several months in Zimbabwe. After considering the reports of the patients, the experts from Health in India advised Dr. Arun Saroha. That's how the patient came to India in the first week of December. Dr. Saroha operated upon the patient, removed, excised the tumor that was present in the brain. Now the patient is doing absolutely fine. Let us ask the patient about the experiences in India, and let us also talk to Dr. Arun Saroha about the kind of surgery that it was, the difficulty level and the challenges that it posed. So now we are joined by Betty from Zimbabwe, her son Alistair, who's been operated upon by Dr. Arun Saroha at Artemis Health Institute. Let's begin by asking, first let me greet all of them. Hello Dr. Saroha.
Hi.
Hi Betty, welcome to India. It's been almost 2 weeks, more than 2 weeks, almost 3 weeks that you've been in India. So Dr. Saroha, I would like to know, when she had sent her reports, it was about a colloid cyst. So what exactly is a colloid cyst? Was the diagnosis correct, or did you find something different?
No, the diagnosis was correct, and it was a small colloid cyst which had caused obstructive hydrocephalus to him, for which he underwent a VP shunt surgery at his country, and here he had come for the excision of the colloid cyst.
Okay, so colloid cyst, excuse me for my lack of knowledge about it, but colloid cyst is not a malignant
No, it is not a malignant thing. It's a benign, yes, I would say a benign lesion, not even a tumor I would call it as, and it is a collection of a mucoid material which blocks the foramen of Monro, leading to the obstruction of the CSF flow in the brain and ultimately leading to headache or lack of consciousness in some patients.
So just like we don't know much about why the tumors are caused in the brain, do we have any idea about why a colloid cyst gets formed in the brain?
Yes, it is due to the accumulation of the fluid in a membranous pouch there, which is not very rare, but then it can happen and it does not have a specific reason for it.
And Dr. Saroha, you do all kinds of difficult brain tumors and spine surgeries. So how difficult is this kind of surgery?
This is difficult only in the sense of two things, that you have to go deep inside the brain, and because the patient, when he comes to you or she comes to you, is very much nearly normal, and you have to ensure that the patient does not get more deficits.
Okay, and from what I perceive, what I see, Alistair has been absolutely fine. So you say this is a 100% successful surgery?
Yes, sir.
So what is the prognosis now?
He is free from his disease now. That's what I would say.
So are there chances of any recurrence or anything?
No, if you remove it partially, as it does happen in some cases at times, it can recur. But in his case, that is not the case. We have removed the membrane, the sac, as well as the whatever fluid was there inside it.
So now Alistair can do virtually everything what any other person would be able to do?
Yes, Diaz is actually a national level player, and as well as a very intelligent kid, and I think he would be able to do both the things at the same time.
So any kind of period after which he can start his normal
I think he is nearly leading his normal life except the strenuous activity, but in about 2 months' time he should be gradually increasing his activity to become a player again.
Wow, that's great. Welcome Betty once again. Tell us how it all, for how long have you been getting this treatment and how did it first appear to you?
Okay. Alistair started complaining of headaches in October 2011.
Okay.
He had a CT scan, and unfortunately the physician did not pick up the lesion. And then he collapsed while playing hockey in April of this year, following which he started having seizures and gradually went into a coma. He had to go in for surgery, emergency surgery, because he'd developed hydrocephalus. And he's had a VP shunt inserted. And unfortunately, Zimbabwe does not have the technology to perform the required surgery. We then went on the internet and researched, and together with the Zimbabwean surgeon, neurosurgeon, we researched about Dr. Saroha and Artemis Hospital, and this is how we came to communicate with you.
So Betty, you were in touch with Health in India with regards to Dr. Arun Saroha, and you were parallelly in touch with Max Hospital also.
Yes.
In hindsight, do you think your decision of coming to Artemis and choosing Dr. Arun Saroha as the surgeon for your son was the right decision?
Absolutely.
Okay, South Africa is right next door to Zimbabwe. I know South Africa is pretty much expensive as compared to India. So what were your primary reasons? Did you think India has an equally or maybe a better healthcare in terms of neurosurgery?
Maybe better. I might be wrong. I haven't been quite exposed to South Africa. But yes, we did go to the best hospital in South Africa and one of the top neurosurgeons in Joburg. It was very promising, very good neurosurgeon. But the code that they gave us for the required surgery that Alistair needed, I would have had to sell my house in order to get that surgery done. And only later to find out they were actually flying in neurosurgeons from India to perform this kind of surgery.
And if I may ask, how much did you spend on your hospital bill in India for this kind of surgery?
Total cost today, I'd be lying to you to know the exact figure. But I know for certain that is probably a fifth of what was required in South Africa.
Okay. And you were insured, so probably your insurance company would also be happy to, having to pay much lesser amount for the treatment.
Absolutely. They were not going to be paying even a tenth of what was required in South Africa.
Okay. So, Alistair Diaz, how are you feeling? It's been how many days since you got discharged from the hospital?
I think 2 weeks now.
It's been a week since discharge.
Oh, 1 week.
1 week.
Yeah.
So, are you confident and happy that you have got rid of the disease and you can go back to your field?
Yes.
So, what sport do you play?
I play hockey, swimming, water polo, and I used to play rugby.
Wow, so you are a sort of a decathlon kind of athlete.
Yeah.
You were 17 years old. So
16.
16. So do you think you'll be, do you still want to pursue physically, very, very aggressive athletic career?
Yes.
Wow, that's great. Betty, you were worried about your daughter. So may I say hello to your little daughter, and what's your name, baby?
Stephanie.
Stephanie.
Yes.
So Stephanie, you have been, around here within the hospital, outside the hospital. How have you felt about India?
It's very nice. The workers are helpful. Very helpful.
And how long, how much more time do you have to stay in India now?
About a week.
About a week. So what are the plans now that the medical part is over?
We wanted to visit the Lotus Temple and we just came back from the Taj Mahal.
Wow, so you've been to Taj Mahal? Must have clicked lots of pictures.
Okay.
We'd love to see those pictures, share those pictures on the Facebook or maybe any other social media that you're present. It is a pleasure talking to you over here. Thank you, Dr. Saroha, for giving us an insight into what exactly was the treatment. We hope more and more people from Zimbabwe, they see your experiences and they come to India and avail of these excellent medical facilities. Thank you, everybody.
Thank you.